Chekuri Suvarchala, Scientific Director with Ziva Fertility Centers. Can smoking affect your ability to have a child? Are smoking and infertility interconnected? Well, we are aware that smoking increases the risk for heart diseases, vascular and lung diseases. It's also common knowledge that smoking can also affect fertility in both men and women. These are facts that have been collected from data across the world, and that's what has been concluded after studies. So, how does smoking affect male and female infertility? In the females, the quality and the quantity of eggs comes down in smokers as against non-smokers. In men, there are a lot of issues such as erectile dysfunction, etc., which we will be talking in detail later. How does smoking affect the egg quality? Cigarettes have chemicals such as nicotine, cyanide, carbon monoxide, which speed up loss rate of eggs in the ovaries. This is very common knowledge. But once the eggs die off, they cannot be replenished, they cannot be regrown, they cannot be replaced. So that's the final damage that smoking can do to your ovaries. And menopause also has been seen to occur about 2 to 4 years earlier in smokers as against non-smokers. So this is also a very important factor to remember. In men, it reduces the quality of sperm, definitely. It causes the sperm to have low sperm count, as in the number of sperms that are ejaculated in a semen also are reduced. It affects the sperm's mobility, that is the ability of the sperms to swim forward. It increases the abnormality in the sperms and also damages the capacity of the sperm to fertilize an egg. So these are the effects it has on both eggs and sperms. So how can it affect? So what is the rate actually? Well, the fact is that between smokers and non-smokers, there is a twofold rate of success. As in, if there are smokers and non-smokers, the non-smokers get pregnant twice as fast compared with the smokers. The smokers do not get pregnant as fast as the non-smokers, and the non-smokers have a twofold increase in success rate when compared to smokers. This is a very important factor. And the risk of infertility increases with your number of cigarettes per day. The more cigarettes you smoke, the more the damage on your sperms and eggs, and therefore your ability to get pregnant decreases with the number of cigarettes that you smoke. Not just this, smokers also do not get success with a wide variety of treatment options, be it IUI or IVF. The success rate in smokers is much lower. That's because more drugs which are important for growing the eggs are required in smokers. In women, when they are smoking, more dosage of stimulation drugs are required for growing eggs inside the ovaries, and each time the eggs that are retrieved are also low in terms of IVF. So smokers give out very few eggs and the quality is also compromised. Not only this, they also have a 30% lower pregnancy rate. So not just the quality, the success rate is also drastically affected in smoking women. That's because basically smoking causes damage to the genetic material inside the egg and sperm. Miscarriages and birth defects in offspring are also more in the smoking group of women. It's highly likely to conceive a chromosomally unhealthy pregnancy in smoking women. Ectopic pregnancies, preterm labors are also very common in women who smoke. Can smoking affect children? There has been a very good study which shows that men whose mothers smoked half a packet of cigarette or more in a day had lower sperm count. So imagine that a mother smokes, but the child in his grown-up years, when he's trying to have a baby, cannot because of the smoking issues that his mother had. So it's a long-term effect and it has to be kept in mind. During pregnancy, it can cause growth restriction of the fetus, low birth weights in the baby, or higher risk for medical problems such as diabetes or hypertension. These are very common issues that are seen. It also causes sudden infant death in babies that are born from smoking mothers. So that's also a very important point to be noted. Unfortunately, even if you do not smoke, but you are a passive smoker, as in you're exposed to someone who's smoking, that also is not good for you. It causes detrimental effects on your eggs and can lead to all the complications that I have talked about. And what are your chances if you stop smoking? Well, yes, quitting smoking can definitely improve your fertility. Remember, the eggs that have been depleted cannot be rejuvenated, but whatever is left can be salvaged and those eggs can give us a better success rate. Pregnancy complications also decrease if the duration of your non-smoking period has increased. So if you quit smoking and in a while, maybe 6 months to 1 year, your chances of having an uncomplicated pregnancy are also high. Quitting smoking is not easy, but remember there are many complications, not just medical, clinical ones that are going to cause you deleterious effects, long-term harmful, fatal effects. But when you're trying to have a child, no matter what treatment you take, no matter what kind of money you spend, the success rate will be very low if you do not quit smoking. Whether you're a man or a woman, please make sure that you quit smoking and come for fertility treatment. If you want to understand more, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.